Naproxen and ibuprofen are both non-steroidal anti-inflammatory drugs. Ibuprofen is available over the counter in the United Kingdom, whereas naproxen is a prescription-only medication. Both medications are indicated to reduce mild to moderate pain and inflammation in musculoskeletal conditions. Whilst the two drugs have similarities in terms of their mechanism of action, as they both are non-selective inhibitors of the cyclooxygenase (CoX) enzymes, naproxen's dosage regime and chemical composition may offer some benefits toward it producing a more pronounced pain-relieving effect. There are known structural differences between the two medications. Naproxen's chemical composition favors a more pronounced pain-relieving effect. This is due to its higher affinity bonding for the two cyclooxygenase enzymes, which leads to a stronger and more longer-lasting bond, and therefore more prolonged pain-relieving, whereas ibuprofen has a smaller molecular size than naproxen, which it enables it to be more rapidly absorbed through the gastrointestinal tract, and henceforth into the blood, and in doing so, can begin to have a pain-relieving effect quicker than naproxen. When looking at the studies comparing their effectiveness in reducing pain, the studies available have shown mixed results. Ong et al. 2007 showed an equally effective outcome for naproxen and ibuprofen for reducing acute and chronic pain. But they found differences in the safety profiles of the two medications, with ibuprofen representing a slightly higher cardiovascular risk. Treller et al. 2011 conducted a meta-analysis of randomized controlled trials that evaluated the efficacy and safety of multiple NSAIDs, including naproxen and ibuprofen. They found that both were similarly effective at relieving pain in conditions like arthritis. Buchanan and Amadio, 2004, conducted a single-blind, randomized crossover study comparing efficacy and safety of naproxen and ibuprofen in patients with osteoarthritis of the hip and knee. They found that both were comparable in terms of their efficacy of reducing pain and stiffness. How you respond to either of these medications will, as mentioned, depend on the reason you require these types of medications, your overall health status, and the dosage and formulation. Ultimately, one could argue that you may derive more effective and prolonged pain relief from being prescribed naproxen.